Good afternoon, everyone. I'm Dr. Akhila, consultant fertility specialist, Sudha Hospitals, Banjara, Hyderabad. Today, we're going to talk about age and how it affects fertility. So let's quickly understand that, like I say in all my videos, fertility is not just a play a very vital role in fertility. So delayed childbearing is now a challenge in reproductive health because once the age is higher, the chances of fertility, whether it is naturally or through technologies, becomes very difficult. The reason being, as the age advances, quality of the gametes also comes down. Now, first, let's talk about the age of the females. So, the female usually is born with a fixed number of eggs, and from this resting pool, every cycle a few eggs get recruited, one goes out of that, and that's how ovulation happens. So once the age advances, the number of these eggs keep coming down. So for women who have becomes a challenge. Not only that, with increase in age, miscarriages, the rate of miscarriages also increase, and the incidence of diabetes, hypertension, placental abnormalities, all these increase with the increase in age. So trying to understand at what point does the number of eggs come down. So fertility below less than 30 years of age is usually quite high. So we can expect about 85% pregnancy rates within a year if a woman is trying naturally within 30 years of age, less than 30 years. So between 30 and 35, the success is slightly less, which is about maybe 70%. And beyond 35, at around 37, it's usually further lesser. More than 40 years, the success rates are much less, probably say less than 30%. Over a year is what we're looking at. Now, when we come to IVF, in these women, the success rates are much higher if the age is lesser. That is between 30 and 35 years of age, the success of IVF is usually about 50%. That is, this is an overall success rate. It all depends upon the number of eggs the woman has. Some women have lesser eggs even at a younger age, so the quality of these eggs is much lesser. So these kind of women are someone that we have to pick up and counsel them for early fertility treatments. IVF is one option for women with fewer number of eggs. Also, the other option through IVF is egg freezing. Egg freezing is considered in those women who are delaying their fertility process either because of career options, professional options, unable to find a partner. All these kind of women can avail this newer technology, that is freezing of eggs. Uh, the eggs are extracted through IVF process, and the eggs are frozen, that is vitrified. So these eggs later on can be used to continue the process of IVF, that is mixed with the husband's sperm and create embryos and go for a transfer at a later date. So once the egg freezing is done at a younger age, obviously the quality of the embryo thus formed is much better. These are some of the aspects of age in women. Now, age in men also plays a very important role. Men older than 40 years tend to have lesser numbers in terms of the sperm count. Also, the quality of the sperms is much less, more than 40 years. So, what problems can we expect is we can expect miscarriages in women whose partner is more than 40 years old. Not only that, features of autism, schizophrenia, bipolar diseases, all these also can be expected with men who are more than 40 years old. These are some of the factors that tell us age is a very important factor. So, early fertility and reproductive health planning is something that is very essential in all the couples, how they're planning their fertility, at what age should they expect, and how many children are they expecting. Depending on that, when to start their planning is something that we need to educate all the couples around. So in olden days, it was thought that fertility is a curse, but now we understand that fertility is actually a disease, it's a problem which can be cured. So there are multiple methodologies and methods that we can cater to and solve this issue of infertility. Thank you. Any questions, please? I am already getting scared at 31. I want to try at 32. Is it safe? So it all depends on your egg count, your partner's semen analysis, your hormonal levels. So what is a must is that you must consult a fertility specialist, go through a scan, look at the number of follicles that are there, get an AMH done. AMH is anti-Mullerian hormone. So the ultrasound with antral follicular count and the AMH test gives us a very good indicator about the quantity of the eggs and also the semen analysis. Should everything be okay, you can wait till the 32 years. Ma'am, is there any chance of getting a miscarriage after 30 years of age? So the chance of miscarriage definitely increases with increase in age. At 30 years, the incidence is not very high. One miscarriage is something that is sporadic. Multiple miscarriages is what happens whereas the age increases. I'm 38 years old. My AMH level is also normal. Can I get pregnant naturally? So no, as long as the tubes are patent, the endometrial lining is good, sperm count is adequate, intercourse is happening, your egg count is okay. Nobody can really say that you cannot conceive naturally. Though at 38 years of age, the chance of a natural conception, if it is seen over a period of 1 year, is quite less, to probably say around maybe 30%, but it is not 0%. 38 years, more than even consideration of pregnancy. What we are worried about is these miscarriages and chromosomal abnormalities. These are the two things that we must keep in mind, because as the egg age advances, the chances of miscarriages and the chances of chromosomal abnormalities in the baby thus born increase. I froze my eggs at 32 and I am now 36. Using my eggs now will result in a positive pregnancy, or do I have complications? So at 36 years also, you need to undergo these tests that I just mentioned, that is your egg count tests, the semen analysis of your husband, and it depends on how many years you're married for and if you're just, how many years have you been trying for. But you can also at 36, if everything is okay, you can try even naturally for a couple of months or try 1 or 2 IUI cycles and then proceed for using your frozen eggs. So you should give yourself a chance of trying naturally uh, depending on the rest of the parameters. And yes, you can definitely use your eggs. There are no complications. Eggs frozen at the 31, 32 years are much better eggs than the eggs at 36 years old. Next question, please. At what age do the egg quality and the sperm quality start to decrease? So the age typically after 35 years of age in women and after 40 years of age in men is what we typically tell. How to increase natural fertility after 40 years of age. Natural fertility after 40 years of age is very, very less than 20 to 30%. Also, depending upon the number of eggs, usually at 40 years of age, there are very few eggs that are remaining. Uh, and the count, the sperm count also is very important. So, antioxidants, regular exercise, good sleep, uh, stress-free life. These are some of the healthy diet, of course. These are some of the tips for natural conception. Does having a healthy pregnancy before indicate a future success? Not essentially. There is something called as secondary infertility. That is, some couples do have a first pregnancy, which is a natural conception, but they have trouble in conceiving for the second child. The tests that I already mentioned for checking the egg count, the sperm count, the tube test, all those have to be done. And if everything is normal, depending on the age of the couple, you can still try naturally for a couple of cycles and later on proceed for fertility treatments. Thank you very much.